is so important for us to come together to talk about cardiovascular disease and start to think about tangible solutions on how we make progress. Cardiovascular disease is the biggest killer worldwide. There are approximately 18 million people dying every year of cardiovascular disease. And the most incredible thing is 80% of those deaths are preventable. We have the medicines, we have the diagnostic tools, we have the technology. So we need to come together and make sure we can identify patients, create the care pathways, and make sure that we reduce this burden to the healthcare system and most of all to patients. I think it's very important for us to come together as a collective, different stakeholders who are seeing things through a different lens, to talk about the biggest killer worldwide, which is cardiovascular disease. That's why summits like these are truly important, because we're starting the dialogue on how can we solve this together as a collective. If I had a magic wand, I would take the sense of urgency that we had with COVID and apply it to cardiovascular disease. We see 18 million people dying every year of cardiovascular disease. Throughout the whole pandemic of COVID, we saw 15 million people. So we have to have this approach that is much more proactive, that is thinking about prevention, that is bringing people together to actually find the solutions that are necessary to address this burden. And I think if we work together, we can be just as effective as we were with COVID.